Welcome dear students to our second chapter in science. The second chapter in science is health and diseases. Now this is quite an easy chapter and this is based on our own experiences in our day-to-day life. Okay. The first thing we will look at is sickness. What happens when we become sick? I'm sure that all of you all must have fallen sick at one point or the other in your life. What happens when you fall sick? Our body temperature increases, we feel weakness in our body, we don't feel like doing any work, we want to take rest, we don't want to go to school, okay? We just want to be sleeping the whole day, okay? This is usually what happens when you fall sick. And what exactly do you do? Every time you fall sick, do you go rushing to a doctor? At times we may, at times we may not, okay? If you are too much sick, when you are not able to get well all by yourself, you have to go to a doctor, you have to visit a doctor. The doctor will check you up, find out why you've fallen sick and give you medicines, and in a few days time you become better. But there are other sicknesses wherein we don't actually need to go to a doctor. We just need rest for maybe a few days, and then slowly our body recovers and we become alright, okay? So as I said, we all have fallen sick at some point or the other in our life. Health. Now we just spoke about sickness, so what do you think health is? When you call someone a healthy person, it means that that person is not a sick person, he is healthy, he is fit and fine. What is the meaning of health? It is a state of complete physical, mental and social well-beingness. What is the meaning of this statement? It means that when you are healthy, you are physically healthy, you are mentally healthy and you are socially healthy. Means your physical body is fit and fine, your mental health, the health when it comes to the type of things that you're thinking positive things, you're not thinking negative things. It means that your mental health is fine. And finally, your social well-beingness, how you are communicating with the society, how you are interacting with other people. If that is also healthy, if that is also in a positive manner, it means that you are a healthy person. It is not merely the absence of any disease, okay? So when you say that a person is healthy, it may not be just the absence of a disease, okay? It can also affect the mental ability of the person and also the ability of the person when it comes to interaction with the society. Diseases. Some of the diseases that you have heard about, or maybe you know of certain people who are suffering from those diseases. The most commonly known diseases are diabetes, common cold, asthma, heart diseases, Down syndrome. These are very common diseases, and maybe you have yourself experienced common cold at some point or the other. You might know someone in your family who might be having diabetes or asthma or heart diseases, or you must have seen small children who are suffering from Down's syndrome, okay? So all of us are usually well aware about all these diseases mentioned here. Now, what are the reasons and symptoms as to why we become sick? It is a condition of disturbances in psychological and physiological processes of the body. What exactly happens when you fall sick? As we just discussed in the previous slide, when you fall sick, it affects you physically as well as mentally. So when your body is getting affected physically, it is called as your physiological processes. Your physiological processes are getting affected. And on the other hand, when your mental health gets affected, it is called as psychological processes. Your psychological processes are getting affected because of diseases. Types of diseases. Now diseases can be classified, or broken up into different categories based on two main things: duration and the reason. Duration means for how long time does the disease occur in that organism. Okay, so based on duration you have chronic diseases and you have acute diseases. According to reason, the reason why the disease has affected the organism, based on that you have hereditary diseases and you've got acquired diseases. Acquired diseases can be further broken down into non-infectious diseases and infectious diseases. First, we will look at infectious diseases. Now, diseases does not occur just by itself. There are certain things which will come in contact with the organism, because of which that organism will fall sick. Okay, and what are those things usually? It could be air, water, food, insects or animals. Okay, whenever there is some kind of bacteria or virus in the air, okay, then it is said that that person is affected by airborne diseases. When the person drinks any water which is contaminated or which contains certain viruses or contains certain bacteria or certain pathogens, then that person is said to be affected with waterborne diseases. When we eat contaminated food, when we eat food which is spoiled, we can be affected by diseases which are called as foodborne diseases, diseases which have occurred because of eating infected food. Insects, when we are bitten by certain insects, for example mosquitoes, then we might get certain diseases like malaria or dengue. So those diseases are called as insect-borne diseases. And finally, animals can also cause diseases to organisms. Like if you are bitten by a dog or by a monkey, you get a disease which is called as rabies. So those are diseases which are caused by animals. We will now look at a certain number of diseases. We will try and give you an in-depth study about it. The first one that we are going to look at is tuberculosis. Now, tuberculosis is caused by a bacteria. It looks something like this. Okay, the bacteria's name is Mycobacterium tuberculi. The symptoms: what happens to the person when that person gets tuberculosis? That person will get chronic cough. That person will continuously keep on coughing. No matter how much medicines that person takes, the cough is not going to get stopped. Okay, so that is chronic cough. Bloody spitting, when the person spits, when the person who is having a TB or tuberculosis spits, there might be blood in that spit. Emaciation and difficult breathing, the person faces difficulty breathing, is not able to breathe very easily. Mode, how can that person get infected by TB? Spitting by patients through air, prolonged contact with and sharing of materials with the patient. Now if a person with TB is spitting on the road, then the germs of TB, the Mycobacterium tuberculi germs, can get spread through that spit. Okay, if you are in constant contact with a person who is already suffering from that disease, then maybe you can also get that particular disease. Treatment, is there treatment available for TB? Yes, definitely there is treatment available. You are given a vaccine which is called as a BCG vaccine. Okay, this is the most effective vaccine for TB. Apart from that, isolation of the patient has to be living separate from remaining healthy persons. Regular medication like DOTS. DOTS is a special medication which is given freely to people who are having TB, so that they can usually the poorer section of the society who are not able to afford costly medicines, it is basically a big boon for those people. They can get these DOTS medicines free from the government, and they can continue with their medications and completely get cured of TB. Okay, so the treatment for TB is BCG vaccine, isolation of the person, keeping that person away from healthy people, and regular medication like DOTS. The next disease we look at is called as hepatitis. The hepatitis is also called as jaundice, and this disease is usually what affects the liver. This is what the jaundice or the hepatitis microorganism looks like. Now the pathogen or the microorganism which causes hepatitis is either hepatitis virus A, B, C, D, E. So you've got 5 types of different viruses which can cause hepatitis. The symptoms, what are the symptoms? What will happen to that person? How will you understand that that person is suffering from hepatitis? Anorexia, the person does not want to eat food. उसको भूख लगती नहीं है. अगर खाना खाएगा तो भी उसको ऐसा लगेगा कि मैंने बहुत कुछ खा लिया है, मुझे नहीं चाहिए. So that is called as anorexia. Yellow urine, the urination is very yellow in color. General weakness and vomiting, the person has a lot of weakness, is not able to do any much physical activity, and usually the person suffers from a lot of vomiting. Mode, how does the person get jaundice or hepatitis? It is due to contaminated water or sharing of needles or blood transfusion. If you have contaminated water which is not properly boiled and cooled and filtered, then you can get you can get hepatitis. Sharing of needles, if this usually occurs in people who are drug addicts on the road, they usually do drugs with the help of needles and they share the same needles, which is a very dangerous thing to do. So it can happen due to sharing of needles. And blood transfusion, when you go to a hospital for the process of blood donation or for the process of blood transfusion, you have to be very careful that the people over there are using sterilized needles, new needles. You cannot be using someone else's needles on you for blood transfusion or for blood donation. Treatment, how do you treat jaundice? Drinking boiled water and proper cleaning of hands. When you're cleaning your hands, you have to make sure it has to be properly cleaned with soap and water, and you are drinking water which is filtered, boiled and cooled. The next one, dysentery. Dysentery is when you get a lot of pain in your stomach, in your abdomen, and you need to go to the washroom again and again. You get loose motion. That is dysentery. The microorganism which causes dysentery, there are 2 types of microorganism. You've got one which is Shigella bacilli, which is a bacteria, and the other one Entamoeba histolica, which is a protozoa. Symptoms, how do you understand if the person is having dysentery? Watery stools, as I said, loose motions, and pain in the abdomen. You get severe pain in the stomach. Mode, how does the person get dysentery? Contaminated food and water. If you have food which is unhygienic, which is not stored properly, water which is not properly filtered and boiled, you can get dysentery. Treatment, what is the treatment for dysentery? Drinking boiled water, proper storage of food, and ORS consumption. So the main thing is you have to be drinking clean, filtered, boiled water, and your food should be stored in a proper place. You should not be eating any food which is not hygienically stored. ORS consumption. What is ORS? ORS is a mixture which has been specially prepared to make sure that your level of sugar and salt in your body is proper. If the level of sugar or salt in your body goes down, what happens is that you fall sick. Okay, and over here in dysentery, what happens is that because you're getting watery stools, you're continuously getting loose motions. The body, the amount of salt and the amount of sugar in the body is getting lower and lower. So that is why you have to be having ORS, which is mixed with water and which is had. So this brings up or maintains the level of water, of sugar, water and salt in your body. Next is cholera. In cholera, what happens is that in cholera, first of all, the microorganism which affects which causes cholera is called as Vibrio cholerae. The symptoms are very similar to your dysentery. You get vomiting and you get severe diarrhea, you get a lot of loose motions and cramps in the stomach and in the legs. You get pain in the stomach, you get pain in the legs. The mode, how is it caused? Contaminated food and water. So again and again we see students that contaminated food and contaminated water is causing a lot of diseases. So we have to make sure that whenever we eat something, we eat it from hygienic places. Okay, the water that we drink has to be properly stored, has to be filtered, has to be boiled, has to be cooled, and then only we can consume that water. Treatment, drinking boiled water, follow personal hygiene and vaccination. For cholera there is a vaccination which is available. Those vaccinations can be taken and people can avoid getting cholera. Apart from that, drinking water which is hygienically stored, having food which is hygienically stored, and personal hygiene. You should keep yourself clean, neat and tidy. The next one, typhoid. Typhoid is caused by an organism called as Salmonella typhi. The symptoms, how do you understand if a person has got typhoid? Anorexia, the person does not want to eat. Headache, rashes on the abdomen, there is very severe headache, the patient suffers from a lot of headache. Rashes on the abdomen, on the stomach you get a lot of rashes, small tiny red colored itchy sensations and those prickly kind of boils which occur on the abdomen. Loose motions and high fever. There is also high fever in patients who are having typhoid. Mode, again this is caused by contaminated food and water. And finally the treatment, drinking boiled water, proper disposal of sewage and vaccination. So vaccination is also available for typhoid. Apart from that, your drinking water, your food has to be proper, and you also have to make sure that the waste products, the waste things, the sewage is properly disposed of. Next is dengue. It is caused by mosquito bites, and the mosquito which causes this particular disease is Aedes aegypti. The pathogen, the microorganism which causes this particular disease, which causes dengue, is called as DEN1 or DEN2. There are two types of viruses, it's either DEN1 or DEN2. Symptoms, what happens when a person gets dengue? Acute fever, very high fever, you get headache, vomiting, pain in the eye socket. The eye socket, you have your eyes are located inside a socket. So behind your eyes you feel very terrible pain. Decrease in platelet count leading to internal hemorrhage. Your blood contains three different things. It contains white blood corpuscles, red blood corpuscles and platelets. Now when the platelets decrease, the amount of platelet decreases in your blood, what happens is that person feels very sick, and there is high chances that internal bleeding can start in the body. Okay, so this is usually what happens in dengue. The next one, swine flu. Medium, how does it occur? It has occurred through pigs and humans. Maybe some pigs were contaminated with this particular virus, and that pig must have got in touch or must have come in contact with human beings, and that is how that virus got transferred from pigs to the human beings. Spread. Virus of swine flu is spread through sweat, nose secretions and saliva of infected person. If a person is already suffering from swine flu, if anyone else gets in contact with that person, it can, if he gets in touch with the sweat of that person or with the nose secretions, the liquid coming out from the nose, or through the saliva, the spit of that infected person, it can be that the healthy person will also get swine flu. Symptoms, difficulty in breathing, sore throat and body pain. What are the symptoms? You are not able to breathe properly, your throat, there is a lot of itchiness in the throat, you get pain in the throat, and body ache, you have a lot of pain in your body. AIDS. The next one that we are going to learn about is AIDS. The full form of AIDS is acquired immunodeficiency syndrome, and it is caused by a virus which is called as HIV or human immunodeficiency virus. How is it spread from one person to the other? Sharing of needles with infected person. If a person is suffering from AIDS and if that person is sharing needles with someone else, that other healthy person can also contract AIDS. Sexual transmission, and from an infected mother to an unborn child. If a mother who is pregnant is having AIDS, then the baby who is going to be born will also get AIDS. Symptoms. The victim suffers from various diseases due to progressive weakening of the natural immunity. Now, there are no exact symptoms with regards to AIDS. You cannot say that if the person is suffering from this particular things, then the person is having AIDS. Now, what happens in AIDS is that the overall immunity of that person decreases. So the person may fall sick due to any reason. Okay, he might get cold, he might get typhoid, he might get pneumonia, he might die of anything else. Okay, so that is happening because of the weakening of the natural immunity. The person becomes very weak and the person becomes very prone to getting sicknesses. Rabies. Now, how does rabies occur? It is a viral disease. It is caused by a virus and it occurs due to the bite of an infected dog, rabbit, monkey or a cat. Okay, so many people who are having pets in the house like a rabbit or a dog or a cat, you have to be very careful. You have to be giving those pets of yours proper vaccinations from time to time, because if you are not giving them vaccination and if by chance your pet animal bites you, you might get a chance of getting rabies. Prevention, timely vaccination. As soon as you are bitten by the animal, either by a cat or a dog or a rabbit or a monkey, you have to make sure that you have to visit the doctor and take vaccinations. Previously, the vaccinations of rabies were very painful. There were 14 big injections which were given in the stomach area, in the abdomen area. Okay, and they were really very painful. But now the vaccinations have changed. Now you just have to get, I think, 3 or 4 vaccinations every week or after every 15 days. I'm not very sure of that, but that's the number of vaccines which have reduced, and now they are taken in the arm, so it's not very painful as well. So please remember, students, if you are ever bitten by any animal, make sure that you visit a doctor and take a rabies vaccination. Symptoms. What are the symptoms of a person who is suffering from rabies? You will get fever for 2 to 12 weeks. Okay, exaggeration in behavior. You will not be able to behave in a normal manner. Your behavior will change completely. Hydrophobia. The person gets extremely frightened of water. He would not like to take a bath, he would not like to drink water, he would not like to keep himself, wash himself with water. Okay, so this is called as a fear of water or called as hydrophobia. The person starts getting frightened of water. Symptoms start to appear within 90 to 175 days of the dog bite. Now the person will not start showing the symptoms immediately. It might take 90 days, or you can say around 90 to 175 days, a very long time for the symptoms to start showing. Okay, but you must not wait for these symptoms to start showing. You get a dog bite, it is better that you immediately go and get yourself vaccinated with the rabies vaccine. Now you have non-infectious diseases. Non-infectious diseases are diseases like cancer, diabetes, heart diseases. Means if someone is having cancer, okay, if you touch that person, you will not get cancer. If someone is having heart diseases, if you touch that person, you will not get heart diseases. Okay, so these 3 diseases are non-infectious diseases. So what happens in cancer? Cancer is an uncontrollable and abnormal cell growth when the cells in the body are growing continuously in an unnatural manner. They are not growing in a natural manner, it's growing in an unnatural manner, and they are growing uncontrollably. The body does not have any control on the growth of the cells. That is called as cancer. Now, your cancer can occur in various parts of the body. It can occur in the lungs, in the mouth, on the tongue, in the stomach, in the breasts, in the uterus, on the skin, inside the blood, and also in the brain. So, you've got your cancer which can occur in various parts of the body. Symptoms: how do you understand if a person is suffering from cancer? Chronic cough, the person gets constant cough. Incurable scars, if the person gets any cuts or gets any injury, that cuts or those injuries, the scar which is formed does not get healed very fast. Lumps, you might find a certain lumpiness in your body, in various parts of your body. Unexplained weight loss, the person might suddenly start losing a lot of weight. Backaches, the person can get severe aches in the back. Reason: why do people usually get cancer? It is because of consuming tobacco, alcohol, gutka, and excess junk food. Okay, so people who use a lot of cigarettes, who drink a lot of alcohol, they are very prone to getting cancer. And apart from that, people who eat a lot of junk food, like your McDonald's, your Burger King, your Subways, and all these different junk food that we eat, including your Chinese, okay, all the things that we love, yes, they are all called junk food. So when we have excessive of it, excessive junk food, then we can our body can start developing cancer. Diabetes. The next one is diabetes. When low levels of insulin is produced in the body. Insulin is a certain chemical which is generated inside our body, which has control over the amount of sugar which is present in our blood. Okay, but when that insulin is not produced by the body, or the insulin is produced in very little amount, what happens is that the amount of sugar which is present in the blood increases, okay, and this causes a lot of harmful effects. So this particular condition is called as diabetes. The glucose level cannot be controlled. As I said, the amount of sugar, or you can say the amount of glucose in the blood, is not controllable in the process of diabetes. Symptoms: how do you understand if the person is suffering from diabetes? Frequent urination at night. The person has to get up at night and continuously go to the washroom. Excessive weight loss or weight gain. The person might suddenly become very thin, or suddenly the person will have a lot of weight gain. The person might start becoming fatter and fatter. Reasons: it is a hereditary disease. Now usually people who are having diabetes, it can happen that their children can also suffer from diabetes. Obesity: if you are very fat, okay, if you are having a lot of weight gain, that can also cause diabetes. Lack of physical activity: if you are not physically active, if you are just sitting in the house the full day watching TV doing nothing, then that can also occur to you getting diabetes. Mental stress: if you take a lot of stress, that can also cause diabetes. The next one, heart diseases. Heart diseases is the decreased heart efficiency. You know that your heart has to be continuously pumping blood to all the various parts of your body, but when your heart is not able to do its work, okay, it means that your heart is having some problem. It means that your heart is having some disease. Decreased blood supply to the heart muscles. If the amount of blood which should be going to the heart is reduced, then your heart will start getting problems. Stress on the heart leading to heart attack. Now what happens is that when your heart is not able to pump the blood in the required amount, your heart is under stress. It is not able to do its work correctly. So this causes heart attack. Reason for heart attack: Now, what are the things due to which people can get heart attack? Smoking, alcoholism, having a lot of cigarettes, BDs, alcoholism, having alcohol, high BP, people who are having high blood pressure can also get heart attack. People with diabetes can get heart attack. People who are having obesity, who are extremely fat, they can also get heart attack. Lack of physical activity, people who are just sitting the whole day, not doing any physical activity, they can get heart attacks. Mental stress, again the people who are under extreme stress. Anger, anxiety, people who are very hyper, who get angry very fast, or who are anxious, who get frightened very fast, they can also get heart attacks. Okay, so this brings us to the end of this particular lecture. In the next lecture, we will continue further. Till that time, I would like you to read the particular chapter, and if there are any important diagrams which you feel you want to draw, you can practice it in your notebooks. Okay, so till that time, my dear students, stay safe, stay healthy. Bye.